In this video, you'll get a quick overview of Vibrant's gut zoomer test. First, I'll walk through each section of the test, highlighting key features. Then, I'll explain the technology and the Vibrant advantage. We'll review collection instructions and identify which types of patients benefit most from this test. I'll also suggest synergistic tests and end by summarizing the key takeaways and where to go for additional information. The gut microbiome includes the trillions of microorganisms, mainly bacteria, but also viruses, fungi, and other microbes, that reside in your gastrointestinal tract, particularly the large intestine. These microbes form a complex and dynamic ecosystem that plays a crucial role in maintaining health and supporting many bodily functions. The Gut Zoomer is an advanced tool designed to provide a comprehensive analysis of gut health. Unlike traditional stool tests that focus solely on gut bacteria, pathogens, or a limited set of markers, the Gut Zoomer evaluates multiple critical aspects of the gut ecosystem, including archaea, fungi, viruses, and a broad array of gut health markers such as gut inflammation, digestion, immune balance, gut antibodies, malabsorption markers, gut metabolites, and gut diversity indices. This thorough assessment offers an unparalleled view of gut function and its impact on overall health. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The full Gut Zoomer report includes a cover page, introduction, questionnaire results, a summary with marker interpretation, educational infographics, and science-backed personalized recommendations for optimizing the gut microbiome, and then ends with a list of all the markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. The Gut Zoomer questionnaire data populates next, allowing for more accurate results interpretation. It asks patients to rate their GI symptoms by severity and includes questions about lifestyle, dietary pattern, digestive function, medical history, and health concerns. The rest of the report is split into 3 panels: gut commensals, gut pathogens, and the gut inflammation and metabolites panel. Note the gut inflammation and metabolites panel includes 5 subpanels: gut inflammatory markers, digestion and immune balance, gut antibodies, malabsorption, and gut metabolites. Let's walk through each section now. Starting with gut commensals. Diving back into the report, the first page of the summary includes Shannon's and Simpson's diversity indices. Shannon's and Simpson's measure gut microbiome richness and evenness, respectively, assessing resilience against disease. To the right is a pie chart showing phyla distribution, including the major phyla Firmicutes, Bacteroidetes, Proteobacteria, and Actinobacteria. Underneath those 2 are microbial composition ratios, the Firmicutes to Bacteroidetes and Prevotella to Bacteroides, which help to identify dysbiosis and guide targeted interventions. These markers are all based on the 5 pages of commensal bacteria that populate at the end of the report. Although the full list of gut commensals comes later in the report, the next part of the Gut Zoomer categorizes the gut commensals into 14 risk categories and 46 subcategories, offering actionable insights into the gut microbiome. These gut commensals summary scores identify your patient's risk for developing conditions like inflammatory bowel disease, irritable bowel syndrome, and intestinal permeability, based on genus or species that are out of balance. A score of less than 2 indicates in control. A score of 2 to 3.9 indicates moderate risk, and a score of greater than 3.9 indicates high risk. In this example, the hormones category has a score of greater than 6, indicating high risk for estrogen metabolism to be affected, as indicated by elevated levels of beta-glucuronidase producing bacteria. Meanwhile, the SIBO category has a score of 2.5, indicating moderate risk for small intestinal bacterial overgrowth, as indicated by elevated levels of E. coli, which tends to increase after bouts of gastroenteritis, and Methanobrevibacter smithii, which can contribute to methane-driven constipation. The gut commensals summary section ends with a list of supplement suggestions, specifically dietary modifications, probiotics, prebiotics, nutrients, and botanicals for effective gut restoration. Now we're going to leave the summary portion of the gut summary report and skip ahead to the all markers section so we can take a deep dive into the details. The full gut commensals panel analyzes a robust number of essential beneficial bacteria and probiotic organisms involved in nutrient synthesis, immune defense, maintaining the gut barrier, and modulating the gut-brain axis. It identifies clinically significant bacteria like Dialister invisus and Clostridium hathawayii, which are linked to IBS and gut dysbiosis, and often overlooked by traditional tests, and provides in-depth analysis of keystone species like Akkermansia muciniphila and Faecalibacterium prosnitzii, which influence gut integrity and health. The results are populated as both a number and plotted graphically so you can visually see how high or low your patient's results are. Current results are indicated by a dark blue pin, and previous results are indicated by a light blue pin. In this example, the patient's level of Bacillus subtilis increased from 15.8 to 29.3. For commensal bacteria like Bacillus subtilis, the reference range is greater than or equals to 10, indicating you want higher levels of this bacteria. In contrast, opportunistic bacteria have a reference range of less than or equals to 20, indicating you want lower levels of bacteria classes like Bacteroidalis and bacterial species like Bacteroides vulgatus. Now let's talk about gut pathogens. The next section of the summary lists any gut pathogens or antibiotic resistance genes that were detected. Note, pathogen levels are reported using scientific notation, and antibiotic resistance genes are reported as detected or not detected. All out-of-range results will include a comment about each marker so you can learn more about these out-of-range markers. The full gut pathogens panel, which appears later in the report in the all markers section, detects 27 harmful bacteria, 14 protozoan parasites, 15 helminth parasites, 6 fungi, and 12 viruses essential for identifying gut infection, including pathogens often missed in conventional tests, such as 9 pylori Helicobacter species and Edwardsella tarda. The 12 antibiotic resistance genes offer insights into potential treatment challenges. Finally, let's cover the gut inflammation and metabolites panel. The next section is the gut inflammation infographic. The gut lumen serves as a vital interface between the body and its microenvironment, acting as a critical front line for immune and inflammatory activity. As you can see in the infographic, immune cells such as macrophages, neutrophils, and eosinophils release markers at this interface, offering pivotal insights into gut inflammation and the body's defense mechanisms. Note, this panel goes beyond simply looking at calprotectin. It also includes markers like beta-defensin 2, lysozyme, and MMP9, guiding timely interventions. For example, beta-defensin 2 is a robust indicator of microbial imbalance synthesized by epithelial cells in response to bacterial or fungal overgrowth. On the other hand, lysozyme and MMP9 are markers released by macrophages during immune response to pathogens and tissue damage whose quantification provides actionable insights into gut inflammation and underlying conditions such as IBD and infections. The full gut inflammatory markers panel, which appears later in the report, detects 7 markers of gut inflammation, including S100A12, fecal lactoferrin, and fecal eosinophil protein X. As the name suggests, fecal eosinophil protein X is released by eosinophils and associated with food allergies, parasitic infections, and atopic conditions like asthma and eczema. There is so much you can glean from your patients about this panel alone. The digestion and immune balance markers appear next. This panel assesses gut functionality, including pancreatic elastase for digestive efficiency and secretory IgA, commonly referred to as SIG-A, for mucosal immunity. This subpanel also measures fecal pH, blood, and zonulin to evaluate digestive health, microbial balance, and gut permeability, also known as leaky gut. Gut antibodies appear next. This panel offers an in-depth analysis of immune responses to bacteria, fungi, and autoimmune markers. For example, anti-Saccharomyces cerevisiae for fungal reactivity. It evaluates key markers for gluten sensitivity, autoimmune conditions, and bacterial dysbiosis, providing a holistic view of gut health. In addition to ASCA, the panel also includes lipopolysaccharide antibody, tissue transglutaminase, deamidated gliadin peptide, fecal antigliadin, and actin antibody. Malabsorption markers appear next. This section includes advanced testing for meat fiber and vegetable fiber markers. Under normal circumstances, dietary fiber should be metabolized into short-chain fatty acids, organic acids, indoles, and other metabolites, and should not be present in the stool. The quantification of fiber levels provides an assessment of digestive efficiency, highlighting potential insufficiencies in enzymatic or digestive processes. The malabsorption markers panel also measures total fecal fat, total fecal triglycerides, long-chain fatty acids, total cholesterol, and phospholipids. Elevated levels of these markers indicate fat malabsorption, bile acids insufficiency, or pancreatic enzyme deficiency, facilitating accurate identification and targeted interventions to optimize digestive health. The next section of the gut zoomer is the gut metabolites infographic. This image helps explain three concepts. 1. It shows how overgrowth of beta-glucuronidase-producing bacteria can result in high levels of beta-glucuronidase in the gut, which can then deconjugate toxins and hormones, often resulting in increased circulation and reduced intestinal excretion. A real-world example of this is estrogen dominance. Sometimes a patient isn't making too much estrogen. Instead, they simply can't get rid of their estrogen because overgrowth of beta-glucuronidase-producing bacteria is obstructing their detoxification pathway. Number 2. In the upper right, it shows how gut microbes ferment complex carbohydrates, producing short-chain fatty acids like butyrate, acetate, propionate, and valerate. And number 3. Along the left side, it shows how gut microbes convert the primary bile acids, cholic acid and chenodeoxycholic acid, into secondary bile acids, deoxycholic acid and lithocholic acid. You can see the arrow from Ca to DCA and the arrow from CDCA to LCA. Beneath the gut metabolites infographic is a clinical reference chart presenting information about key metabolites in a structured grid-like format. It includes visual elements, i.e. icons of organs and cells, color-coded sections indicating which markers are out of range, and concise clinical summaries, functioning as a visual reference guide to improve patient education and understanding of these markers. The full gut metabolites panel, which comes later in the report, analyzes microbial byproducts like short-chain fatty acids, bile acids, and beta-glucuronidase to evaluate gut function, systemic effects, and detoxification capacity. For example, low butyrate levels may indicate an imbalance in fiber fermentation, potentially impacting gut barrier repair and glucose regulation via the GPR41 and GPR43. Lithocholic acid signals altered bile function and disrupted detoxification through the PXR receptor. And beta-glucuronidase levels gauge the gut's detoxification capacity, as elevated levels can indicate microbial imbalances that impair toxin clearance and hormone metabolism, potentially leading to estrogen dominance. Finally, the gut zoomer summary ends with personalized management plan suggestions based on patient results. These customized interventions include dietary modifications, probiotics, prebiotics, nutrients, and botanicals for effective gut restoration. The comprehensive report supports personalized care based on detailed results, ensuring optimal gut health. Now, let's talk about methodology and the Vibrant Advantage. Vibrant's Gut Zoomer utilizes multiple methodologies, including real-time polymerase chain reaction, antibody tests like sandwich ELISA, immunoassay, microarray, and the fecal immunochemical test, also mass spectrometry, specifically LC-MS for small molecules, and other tests like a pH strip to measure stool acidity. Vibrant uses real-time PCR for accurate identification of gut commensals and gut pathogens. Briefly, DNA is extracted and purified from stool samples. Then, we pair the microbe genes with known complementary sequences, called primers, to identify which microbes are present. Primers are small fragments of single-stranded DNA or RNA designed to bind specifically to a single region in the microbe genome, allowing for precise amplification of the diagnostic target area. Then we use probes to quantify the amount of each microbe. Probes bind to the target area and give off a fluorescent signal as amplification of that area increases. This fluorescent signal is then read by the quantitative real-time PCR machine, where the reaction is occurring to give a quantitative readout. The sensitivity and specificity of our primers and probes are quite accurate, ensuring high sensitivity and specificity. In fact, this 2019 Gut Pathogens article affirmed that Vibrant's pathogens panel has a sensitivity of 95.4% and a specificity of 100%. A specificity of 100% means there are 0 false positives. In other words, if the test shows you have a pathogen, you 100% have a pathogen. A sensitivity of 95.4% means there's a 4.6% chance of a false negative. So your patient may have a pathogen even if it wasn't captured by this stool test. Additionally, Vibrant uses bead beating, enzymatic and thermal processes to remove biofilms, releasing nucleic acids for analysis. Bead beating is a highly effective cell lysis method that disrupts virtually any biological sample by rapidly agitating it with a lysing matrix in a bead beater. Enzymatic and thermal processes use enzymes and heat to break down cell walls and membranes, releasing nucleic acids for analysis. These additional steps increase sensitivity by reducing false negatives. Vibrant uses sandwich ELISA for identification of inflammation markers. ELISA stands for enzyme-linked immunosorbent assay. Basic steps in ELISA include coating a plate with an antigen, blocking nonspecific binding sites with a protein solution, adding the patient's sample, then binding and washing, which means if antibodies against the antigen are present, they will bind the plate-bound antigen. Meanwhile, unbound substances are washed away. Then, a secondary antibody with a chemiluminescent signal is added, which also binds the antigen. Finally, the color intensity is measured by providing a quantitative result. ELISA methodology is a commonly used laboratory technique to detect and quantify substances such as proteins, antibodies, antigens, and hormones. It's widely applied in immunology, diagnostics, and research. Vibrant uses a proprietary protein microarray to quantify gut antibodies, including TTG, DGP, anti-gliadin, anti-actin, anti-LPS, and ASCA. To help you better understand this methodology, I will explain how Vibrant makes the 3 dense microchips used to run this test. But first, please note that the microarray utilizes ELISA methodology. However, instead of 1 antigen per well, Vibrant can measure up to 100 antigens per well. Looking at steps 1 through 3, this is possible because Vibrant attaches antigens to silicone semiconductor wafers. This allows for the bulk manufacture of thousands of identical chips per wafer, creating the ability to scale to volume, and at a very low cost. By repurposing many of the techniques used by the computer chip manufacturers, Vibrant can mimic the advantages seen in the computer industry, significantly improved quality and performance while consistently driving down costs. Looking at step 4, Vibrant then dices the wafers into tiny microchips. In step 5, Vibrant uses automated machines to arrange the microchips, 1 for each antigen, in a 10 by 10 grid atop one pillar on a 24-pillar or 96-pillar plate. The pillar plate is then flipped upside down and submerged into a well of the patient's blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Again, each pillar can measure up to 100 analytes because it's a 10 by 10 grid. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. In summary, this automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Vibrant uses liquid chromatography tandem mass spectrometry methodology, or LC-MS-MS, for quantitative detection of gut metabolites and malabsorption markers, including bile acids, short-chain fatty acids, fecal fat, meat fiber, and vegetable fiber. Vibrant uses mass spectrometry because mass spec is the gold standard for quantifying small molecules. Liquid chromatography helps separate analytes prior to loading into the mass spec machine. Therefore, LC-MS offers high sensitivity and specificity, enabling precise quantification of analytes down to the picogram level detection. Tandem mass spectrometry setup allows for multiple stages of fragmentation, enhancing the identification and quantification accuracy of the compounds. The last methodology we're going to cover in detail is the fecal immunochemical test, or FIT for short. Unlike the guaiac-based fecal occult blood test, or FOBT, which detects hemoglobin based on peroxidase activity, Vibrant uses the fecal immunochemical test, which detects human hemoglobin specifically using antibodies that recognize the globin portion of human hemoglobin. This eliminates interference from non-human hemoglobin, for example, heme from dietary meat, as well as plant-based peroxidase activity seen in raw fruits and vegetables, such as turnips, broccoli, horseradish, cauliflower, cantaloupe, parsnips, and red radish, both of which can cause false positives in FOBT. Finally, let's review collection instructions and how to prepare for this test. The Gutzoomer is a stool test that can be collected at home. Simply fill both collection tubes, the white top and orange top, with stool. The stool collection instructions video is linked in the video description if you desire a full walkthrough. Next, let's discuss preparation. It's important to note that what you want to assess will determine how you prepare. In general, to get the most accurate and clinically useful results, we recommend patients follow their normal diet and lifestyle before collection, unless instructed otherwise by their healthcare provider. This helps capture the patient's baseline gut environment, which is what we most often want to assess. It's best to collect a sample when fasting, so nothing to eat for 8 hours prior to collection, and also to ensure adequate hydration by drinking at least 8 glasses of water per day for 2 to 3 days leading up to the collection, unless fluid restriction is medically indicated. Patients should wait 2 weeks after colonoscopy, as colonoscopy prep dramatically changes the microbiome and it takes at least 2 weeks to return to normal. If a patient is presenting with nonspecific diarrhea or bloody stools unrelated to an acute infection, it is advisable to delay collection. However, if a patient is actively experiencing gastroenteritis with bloody diarrhea, and the goal is to identify a pathogenic trigger, then that may actually be the ideal window for sample collection, since the pathogen is most likely to be present and detectable during acute symptoms. To reduce the likelihood of confounding variables and to ensure data integrity, the following should be avoided prior to sample collection. Patients should avoid probiotic-rich foods like yogurt, kefir, kombucha, sauerkraut, and kimchi for 48 hours before collection, as these transiently elevate levels of certain commensal bacteria. For the same reason, probiotic supplements should also be discontinued for 48 hours prior to collection. High-fat meals and excessive red meat intake should be avoided 24 hours due to their influence on gut-derived metabolites. Digestive enzymes and antacids should be avoided for 48 hours before collection, as they can interfere with markers of digestion and malabsorption. Laxatives and stool softeners should be discontinued for 72 hours, since they alter bowel motility and can affect metabolite and microbiota readings. Antibiotics, antifungals, or antiparasitic medications should be withheld for 2 weeks prior to collection when medically possible. These can suppress or eradicate the organisms the test is designed to detect, potentially resulting in false negatives. In general, please use clinical judgment when deciding whether a washout period is appropriate. In summary, nearly everything ingested, whether dietary, supplemental, or pharmaceutical, can influence gut tumor results. Therefore, doing a dietary intake recall or asking patients to keep a diet, supplement, and medication diary in the days leading up to stool collection may provide valuable context and enhance clinical interpretation of Gutzoomer test results. Now let's talk about which patients benefit most from this test. In other words, when to order a Gutzoomer for your patient. The Gutzoomer is a powerful tool for uncovering the root causes of chronic or unexplained health issues by evaluating the gut microbiome. Consider ordering this test for patients presenting with signs of gut dysbiosis or systemic inflammation, especially those with chronic digestive symptoms like bloating, constipation, diarrhea, or food sensitivities. Also, patients diagnosed with or suspected of having gastrointestinal disorders such as IBS, SIBO, Crohn's disease, or GERD, as well as patients with extra-intestinal symptoms including fatigue, brain fog, skin conditions like eczema or psoriasis, and metabolic or autoimmune conditions such as Hashimoto's thyroiditis or rheumatoid arthritis. Many functional providers know that what happens in the gut does not necessarily stay in the gut. Instead, dysbiosis inflammation within the gut can trigger and mediate chronic systemic inflammation that presents wherever the patient is most genetically susceptible. For the same reason, consider ordering the gut zoomer for patients with a family history of gut-related diseases or autoimmunity, or those who have tried conventional therapies without lasting results. The gut zoomer is especially valuable for identifying hidden pathogens, microbial imbalances, and gut permeability issues. It provides insights into nutrient absorption, immune function, and inflammatory activity, all of which supports the development of personalized management plans tailored to each patient's unique microbiome profile. If your patient is experiencing unexplained symptoms, dealing with chronic health conditions, or recovering poorly from standard interventions, the gut zoomer can help you uncover what's happening at the root in the gut. In other words, the gut zoomer is a foundational test that you can order for just about anyone. Pretty much any patient can benefit from gut zoomer testing insights. Before we talk about synergistic tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to gut zoomer testing, consider the wheat zoomer to investigate serological markers of gluten and wheat sensitivity, along with intestinal hyperpermeability. Also, the food sensitivity and food zoomers, as intestinal permeability can increase the risk of food sensitivity development. Additionally, gut inflammation correlates with a higher incidence of food sensitivities. Also consider the micronutrients panel to investigate nutrient deficiencies when gut zoomer results indicate digestive insufficiency and/or opportunistic overgrowth that can block nutrient absorption. The Candida plus IBS profile to investigate the serological response to Candida species, and the presence of anti-cytolitha descending toxin B or antivinculin antibodies, which are suggestive of altered immunity in functional bowel disorders, and to differentiate between inflammatory bowel disease and IBS subtypes IBS-D and IBS-M. Or the hormone zoomer to investigate estrogen levels and liver detox pathways, especially when gut zoomer results indicate an overgrowth of beta-glucuronidase-producing bacteria or elevated levels of beta-glucuronidase. And finally, the total tox burden, which includes environmental toxins, mycotoxins, and heavy metals tests, to investigate and reduce toxic burden, especially when gut zoomer results indicate intestinal hyperpermeability and/or elevated levels of beta-glucuronidase. In summary, the gut zoomer uses gold standard RT-PCR, ELISA, and LC-MS methodology to identify and quantify over 200 species of bacteria and gut pathogens, along with markers of inflammation, digestion, and gut metabolites, aiding practitioners in detecting root causes of acute or chronic illnesses that stem from the gastrointestinal tract, including gastrointestinal disorders like Crohn's disease, autoimmune conditions like Hashimoto's thyroiditis, and extraintestinal conditions like atherosclerosis, diabetes, eczema, and psoriasis. To learn more, visit the link in the video description. If you have any questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.